Who's K?
I don't know who that is. Let's see. TV. Pause the recording. Wish my eyes were better than this. I don't know where to pause it at.
Oh, over there. Go to the record button and see if you get it again.
Just
Yeah,
stop.
there it is. Yeah. No, stop video. Sorry.
And then
So I would mute while you get to you start.
That made it harder or prevented them from getting the vaccine. And then from there, so we have that information on their worries, maybe reasons for declining the vaccine. Where do you go from there? So we want to know where they get their COVID-19 information and who do they trust with that COVID-19 information. And with those answers, we hope that that will better help you all figure out ways to get messaging to that hesitant population. So those are some of the things that we will talk about today while reviewing this toolkit. And so the first thing you see here is the executive summary. And so if you only have a few minutes to take a look at this toolkit and read about the most pertinent and insightful findings, then please look at the executive summary page. This page will only show you insights about the hesitant population. So first we see here, their main fears and worries are effectiveness, safety, and side effects. And then some that are were not as selected as much, but were still important. People think that they were used to test the vaccine. And then people were worried about past abuse of minority groups and racism in healthcare. And then also, maybe they think that they are currently healthy and they don't need the vaccine. And then we also have, for some of the questions that we ask, we have an other please specify option. So if there are options that are not in the selections that we have shown, we still want to have people have their voice heard. So some of the other responses that we got for fears and worries were that they think that there are unknown long-term side effects. So some of the common side effects we hear are, sore arm, you might have some a fever for a day or two, but they are worried about more long-term side effects. Some have general mistrust of the government, and so that is a reason why they don't trust the vaccine. And some already had COVID and think that they don't need to get the vaccine because they have quote unquote natural immunity. And so from there, from those main fears and worries, we wanted to know if any of those fears and worries were strong enough reasons for them to decline the vaccine. So we see that the top 5 are effectiveness, safety. They think that they were used to test the vaccine. They have mistrust because of past abuse of minority groups and side effects. One thing I want to point out about this data is here you see side effects is the 5th highest, and under main fears and worries, that was the 3rd highest. So we see that it's not as strong of a reason for declining the vaccine as, say, effectiveness and safety that were at the top for both. And so from here, we understand the fears and worries. So what can we do with it? We understand where they get their COVID-19 news. So of the hesitant respondents in Douglas County, 75% of them get their news from online, and then followed by television, radio, and only 20% of the hesitant population gets it from social media. And from whom? Who do they trust in regards to COVID-19 messaging and COVID-19 vaccine related information? So one is their doctor. They trust their primary care physician and their doctors who they usually go for. They have that relationship with that medical professional. 2 is a family member or a friend. And 3 is the internet, an internet search. Something that you will see down here in the data insights. These data insights are comparing the hesitant and non-hesitant populations. So one, you will see here the trusted sources of news. So commonly, not only within Douglas County and within the different demographic groups, but throughout all of the communities we have worked with, their doctor is usually one of the top most trustworthy sources. And that is for both vaccine hesitant and non-hesitant residents. However, Non-hesitant residents in Douglas County tend to trust national and international health bodies as well as their county health department, but instead, the hesitant population trusts their family member or friend and internet search. So that's a difference that we found between the hesitant and non-hesitant population. And when you all go through again, you can take a look at the rest of the data insights, but I want to make sure that I get through the rest of the toolkit. And then here you will see a menu bar on the left side, and you will be able to navigate to the different pages and the different topics of the toolkit. One moment. Sorry about that. Okay. So here we have the current situation, and up top, you will see two filters, and these filters allow you to filter by different groups, and the charts below will update based on the group that you select. So first, since we had such a fantastic turnout, we were able to filter by geography. So right now, the charts show the respondents within Douglas County, but we can also filter to show the respondents within the Omaha and Council Bluffs metropolitan area. So you see that the data is slightly different because it is showing the respondents within those two groups. So we can go back to Douglas County. And here you also see another filter in which you can filter by different demographic groups. So you can filter by age, education level, gender, income, race, and vaccine hesitancy, the hesitant and non-hesitant populations. So I'm not going to go into every single demographic group, but again, when you have the time to dig deep into this toolkit, feel free to play around with some of the different groups. What I will show you is that here we have vaccination status. So of the respondents, 89% are fully vaccinated and 10% had not yet been vaccinated. But one of the groups that we know we really want to pay attention to are the older population, because they have been more vulnerable within the pandemic. So we can look at age and then select the 65 plus subgroup. And we see that this number drops to 5%, which is good because they are more vaccinated than the total respondent pool. So 5% of the respondents 65 plus have not yet been vaccinated. And so again, you can look into any of the demographic groups you want, but I will continue with all of the respondents. And so we scroll down and we see COVID-19 exposure. So have they been infected with COVID-19 and recovered? Have they not been infected, but they are not worried about getting infected? Have they not been infected and they are worried about getting infected? And then the population with medical risk factors relating to COVID-19. So 28% of the respondents have medical risk factors that put them at a higher risk for more serious symptoms with COVID-19. Do you have any questions so far before I jump to the next page?
Nope, you're all right.
Perfect. So next we look at position. So for those who have not been vaccinated yet, we ask, would you get vaccinated today if you had the opportunity? Only 2% said yes. 50% would prefer to wait, but they may get it in the future. And then 47% said, no, I will never take the vaccine. So when we talk about the vaccine hesitant population, we are focusing on these two groups of people, those who prefer to wait and those who say, no, I will never take it. And then again, we look at the concerns which mirror the graph that we showed on the executive summary. So we know that side effects and safety are at the top. And we asked if anyone faced any barriers to getting the vaccine. Luckily, a vast majority said no, none of the above. They did not face any barriers, but the top was availability. They didn't have access to it at the time. Maybe they couldn't get an appointment. And the next was they didn't have enough information to know where to go. And maybe they haven't had the opportunity to take time off of work. And again, we ask other please specify to see if there were any other experiences besides the selections that we showed. And one of them that was mentioned a few times was they were worried they would not be able to take time off of work after getting the vaccine if they had side effects. So a lack of time, taking time off work, things like that. And then this is a really informative chart because we want to know if people's opinions are solely based on the COVID-19 vaccine or if it is vaccines in general. So we ask about the safety and effectiveness of the COVID-19 vaccines compared to the annual flu vaccine and other vaccines that are recommended for children to take. So I want you to focus on this strongly agree column. For the COVID-19 vaccines are safe to take, 49% strongly agree. The COVID-19 vaccines are effective at preventing infection. That drops slightly to 42%, but then goes up when we ask the annual flu vaccines are safe to take. And that goes up even more for other vaccines recommended for children are safe to take. And we have seen that that is a common pattern, not only throughout the different demographics in Douglas County, but with the communities that we have worked with all over the country, that it is not solely a vaccine issue, but people do not as strongly agree about the safety and effectiveness of the COVID-19 vaccine. And so the next page, so now we know the concerns, the barriers, the reasons for declining the vaccine. And so where can we go from there? We see of all of the respondents within Douglas County, their main trusted source is their doctor. And then followed by national or international public health organization and the county health department. But again, if we want to solely look at the vaccine hesitant population, we can select the vaccine hesitant population from the variable filter, and we see that these two drop, and that family member or friend and internet search go up to the second and third place. So we know they're trusted sources, but we want to know where do they get their COVID-19 news? 77% get it from online, 59% from TV, and only 28% of the total population gets it from social media. But this is another of the data points that changes depending on the demographics. So we know that young people traditionally think that they are healthier and don't need to get the vaccine. So we really want to focus on getting the messaging out to them. So if we look at age and then 18 to 34, the youngest subgroup, we see that this number increases to 43%. So 43% of the younger demographic group gets their COVID-19 news from social media. But if we look at the older population, this drops significantly to 11%. And if we go back to all, we scroll down again, and then going more in depth into the social media use, where do people get that information? So 75% get it from Facebook, followed by YouTube, Instagram, and Twitter. And then next, once we understand their trusted sources, where they get their news, and hopefully they want to get a vaccine in the future, what are their vaccine preferences? So where do they want to get their vaccine? So again, they have high trust for their doctor. So they want to get it at their primary care physician's office, followed by pharmacy and community center or mass vaccination center. And then at the time we asked about their preferred appointment method. As we know, it is more widespread and more accessible now, but at the time, a majority wanted it in a first come, first served basis, and a third were indifferent about the way that they would make their appointment. And then a recent addition that we made to our vaccine hesitancy survey was we added questions regarding children, because we know that for a while, adults have been able to have access to the vaccine, But now 12 to 17-year-olds can get the vaccine, and hopefully soon that will get to younger and younger children. So we want to know if the hesitancies or the concerns or lack thereof mirror from parent to from adult to parents of children. And so we see here that like parent, like child, nearly 3/4 of fully vaccinated parents have their eligible children fully vaccinated, whereas 5 out of 6 non-vaccinated parents have not vaccinated their eligible children. And then they make their decisions to get all or none of their children vaccinated. We were wondering if they have, say, 3 children who are eligible, if they pick on a child-by-child basis, but no, it's most of the time it is all or none to get their children vaccinated. And most parents have concerns about the COVID vaccine for themselves and their children, whereas a majority of non-parents have no concerns about the vaccine. So we see that parents are about twice more likely to be concerned with the effectiveness of the vaccine for children than themselves. So we see that parents have a higher concern regarding the vaccine. So if we scroll down here, we look at the vaccinated status for eligible children. So those 12 and up, 64% of the parents, the respondents who have eligible children, they are fully vaccinated. 3% of those children are partially vaccinated, and then 34% have not yet been vaccinated. And then of those who said that they are not vaccinated, in addition to the parents of children who are not yet eligible, we ask if they could get vaccinated, if they could vaccinate their children today, would they? So 22% of those who have not been vaccinated say, yes, I will get my child vaccinated today. And 13% say they will no, they will never get the vaccine. And looking at non-eligible children, so those newborn to 11 years old, if they had the opportunity to get their child vaccinated today, 58% said yes. But we want to look at the concerns as well. So similarly, side effects and safety are at the top. We also added, I feel that they are too young, but that is in the middle, around 21%. And then again, similarly, we want to compare it to other vaccines that are safe for children to take. So we see that 95% of the parents of the children have received all of their recommended doses, and only 1% have not received any of the recommended vaccines. And last but not least, we look at overall vaccine positions. So 61% of children have or will get the COVID vaccine and other immunizations that are recommended for them to take, all up to date. 36% of parents of children are concerned about getting them the COVID vaccine, but their other immunizations are up to date. And then only 4% are concerned about the COVID vaccine, and other immunizations are not up to date. So we really want to focus on this population of the parents who are concerned of getting their children vaccinated. And with the messaging recommendations that we have provided, hopefully that helps you all out to figure out a way to reach that hesitant population. Sorry about that. So yeah, that is the vaccine hesitancy toolkit. We will send you all the link so you can play around with it, play around with the filters, and we are happy to answer any questions that you may have.
So Rebecca, I think everybody should have got the link, right? So they have the link already. I forwarded it from them.
Perfect.
So yes, there are questions. One.
Rebecca, did you get a sense from the respondents who are concerned about safety and effectiveness? What kinds of things that they might have said related to that?
Sure. So some people are concerned about the long-term side effects or kind of the unknowns regarding the long-term side effects. But the way we phrase the side effects response is talking about immediate side effects, such as, you know, the typical fever or cold-like symptoms that some people get. But that is how that's the response that we have gotten so far. Tom, do you have anything to add that you've seen?
Yes. Hi, Tom Herman from Community Data Platforms. I think there's a mix of different emotions about the effectiveness, both short-term and long-term. One thing that was happening while this survey was open was booster shots were starting to be talked about, and a lot of people communicated that if I need to get a booster every 6 months, every 12 months, why even get one in the first place? A lot of people preferring to be infected and gain what they see as natural immunity. But then also, Becca also touched upon this briefly, but a lot of people that had mistrust in the process one way or the other, a lot of concerns about specific political figures, especially nationally, or just political figures more broadly. So I would say that the mistrust in the process of the vaccine being approved and effectiveness and long-term side effects were the largest things that were communicated to us, besides what you see here.
So just to clarify, the safety, which was the #1 concern, is basically boils down to the respondents being concerned about side effects, both long-term and short.
It was mostly, so safety is more generalized of the concerns that maybe it wasn't tested long enough, things like that. So the more generalized, and then side effects was specifically talking about the side effects of getting the vaccine. So yeah, safety is more generalized.
When was the study done and is it ongoing?
This was conducted in the month of August, and it was open for around 4 weeks. So the survey is currently closed. It is not ongoing. So this data is from August. Yeah, collected between August 3rd and August 30th.
I mean, there's a possibility we probably could engage it again. I think that would have to be talked to, but I think there's probably some more work that we're gonna do with them on some other topics. So if we get to the point, then the county board can engage it. But yeah, I mean, we could do it at another period of time. So,
Especially just surveying like the lowest vaccinated populations in particular about their concerns. You know, so.
Rebecca, could you do, the question was that she asked specifically about, you know, surveying the lowest vaccinated populations. Can you all target like that?
So we try to specifically target not only through our communications. So we provide communication templates to the community, the person that we are working with. So at the time we're working with Commissioner Borgeson and Leah Baez. And so they send out the communications to the community members, but we write the templates to specifically, hopefully target the vaccine hesitant population. So that's one way, but also another way is to work with either different organizations or political groups who maybe have an audience that maybe is leaning towards the more vaccine hesitant side. So to get their contacts, their community members, so we can send it out to them. So a goal, yes, is to be able to target those groups. But that is in combination with the stakeholder that we are working with. So it was Commissioner Borgeson. And so, yes, that is a way that we could get more vaccine hesitant respondents.
Rebecca, any thoughts by your team in terms of what would need to be the messaging to address this safety issue? I'm having a little bit of trouble getting my head around the fact that the vaccine's now been out for over a year. And so I'm just trying to find out what might be the messaging to assure people that this, that the safety issue seems to have borne out that this is a safe vaccine.
Sure, yeah. One thing that looking at your data, I think it would be best to partner with the local physicians in your area, because every community is different, but we have recommended that you partner with who they trust the most. So I think that partnering with local physicians or medical organizations for them to provide their insights on the safety of the vaccine, since we know that that is a top concern, to encourage them to get that messaging out there. Yeah, so really focusing on the doctor to have those, especially those one-on-one personal conversations with their patient, is a really effective way to hopefully change their mind and get them vaccinated.
Becca, there were a couple questions in chat.
Sure.
Go.
I can address the first question that I see from, go ahead, Becca, if you want.
Go ahead.
Yeah,
I'm just gonna pull it up.
Sure. So I see there's a question about the sampling methods and survey methodology. As Becca mentioned, with the sampling method, the main way was through outreach to people through email and social media, including the contacts. Becca, you can speak more to exactly who those contacts were. So mostly community outreach through a trusted partner, which is you, Douglas County, and getting people's responses back that way. There was demographically, we noticed a pretty good demographic spread that was fairly representative of Douglas County as a whole. There was slightly skewed to better educated people, slightly skewed towards older respondents. So that was taken care of through survey weighting. So all the results that you're seeing are weighted so they can be considered demographically representative of the county in terms of age, education, gender, race, and income. But in terms of methods for the survey, this is a program that we're continually improving upon, but we do document everything that we do. So if there's specific questions now or later, we'd be happy to be in touch with you over email or now.
Yeah, Tom pretty much covered it. In addition, we try to utilize social media as much as possible. We got a really good response through Facebook with Douglas County. Additionally, you all posted, your local news organization shared a news story regarding the survey to push people to take the survey. But mostly it is through email communications with the email list of whoever we are partnering with. So Commissioner Borgeson and the different commissioners, and through social media. And for the declining the vaccine for other reasons, some of them were similar to the main concerns. So the unknown long-term side effects. We also saw people were worried, similarly to the side effects, they were worried about allergic reactions. And then lastly, for the lack of FDA approval. At the time, it was not FDA approved yet, but that was some of the other reasons for people to decline the vaccine. Tom, anything that I missed?
Nope, that covers it from the list I have.
Perfect.
I have a question. So did you get it and you shared it with your email list?
Or did
Survey?
just, yeah,
The survey, so, the survey, when it was put out in August, it was put out through, the county's communications methods, and then anybody that had that link to forward it on and put it out there. So there were, people associated that had it. I may
mostly-
have forwarded over here to somebody to send out, but it was distributed throughout the county through various methods. It was given to, I know it was given to a few news media, they put it out there and publicized it, so it was basically put out there in mass and asked to be forwarded to, other RAMs and just reinforced throughout that.
So it was only an online survey and that's it? There was nobody like at the mall asking,
No, it wasn't paper like that.
so you had to have access to a computer in order to do this?
Pretty much, and you had to do it online.
Yes, so right now, we are a free survey platform. We partner with organizations or communities like yours to provide these surveys. And we are trying to build that out to include paper surveys in the future. But right now we want to get as many people as possible in the short amount of time that we are out in field. So right now we are just on an online survey.
I guess in the future, if we do this, open it up again, I'd like to know what would it take for them to be confident in the vaccine or help them make their decision.
Yeah, I would just then submit it up if we do it again, because if that's the case, the board has to trigger and go from there. So. Okay.
So, sorry, I missed that question.
Now, a couple of members were just noting some specific questions if we do it again in the future. And it could, depending on what phase we're at or where we go. There could possibly, and I don't know, I'm assuming the next opportunity will probably be whenever there's approval for 5 to 11. And so there may be another opportunity there to see what's what. So when that gets approved, then we'll go from there and see what's what.
Well, and I would think that both the Boys Town and Children's would be interested in if there's additional questions that they would want to include. If there were another survey that would be more specific to their.
That's fair. I mean, if we get to that point, then I'll bring it back, because this time, it's first time engaging with the group, so the board get it there. So for notice now, if we do that, then yeah, I would feedback on that.
Right, and since the situation is constantly changing, we are always open to feedback from the communities that we work with to improve the survey for the future. For example, the first few communities we worked with at the time, children were not eligible. And the main concern was just vaccinating those who were eligible. But now we know that children ages 12 to 17 are eligible, and in the future, hopefully it gets younger and younger. So we updated our survey to include those questions regarding children, and we will continue to make updates to the survey as needed as the situation changes. So again, please feel free to share your feedback or any other information that you were curious in knowing, because we are always looking to improve.
So I'll just make note, if it happens again, I'll just make note to just notify everybody, you have to send me up the questions you got and go from there. And we'll get them pumped in.
Thank you.
Anything else here? Okay, let me know one thing, and Rebecca, you might want to, there was a question from the last meeting asking about breakout. I think somebody asked a zip code breakout. We did talk to them about that. They're working through that. There was an issue that came up that I think they need to work through in respects to what they said thought was some confidentiality stuff, the way they get there, but they're still working through that. So we'll see how that goes.
And access to raw data is, who owns the data? Does anybody have access to the raw data?
We have the data due to us conducting the analyses, but we do not keep the contact information of the respondents.
Right, so yeah, so de-identified raw data, do you have, does like a researcher have access, would they be able to get access to that if they want to do follow-up?
So with our data, we do not share any of the data that is not public. What I will tell you is that we have the option for the respondents to opt in to market research participation, but only if they opt in. And the only data that we share with those with the outside market researchers and market research companies is their demographic information, but none of the vaccine hesitancy or substantial information is shared with those outside organizations.
Yeah, so Rebecca,
Because they
confirm this with me if I'm wrong or not in range. So basically, we partner with them as a free service.
Oh,
When you fill this out on Facebook, you fill out other things with them that you sign off on to some degree, which allows you to be available to them. So for instance, you fill this out. If you agree to be available to do further surveys, you become in this bigger pool. So they build their pool up to build the, I'm not using the correct scientific term, the density up to be able to do these surveys in the future on other matters that they may do to get certain stuff. So, so in the future, the people that participated in this from Douglas County and other stuff you may be doing, there could be some other polling or other topics that they want to get information on. If you assign to do that, you could get that and participate at in some degree.
Okay.
So
Yeah.
that's some of the hook, the give and take on that. Is that fair?
Correct, yes. And we also have an opt-in option for the community survey panel. So that is specifically for Douglas County. If you all choose to conduct future surveys with community data platforms, if you all choose to conduct the vaccine hesitancy survey again in the future, or if we do the other surveys that we offer, such as affordable housing, equity, and economic development. So that survey panel, again, only for people who opt in, do we keep that information. And we are always transparent with our privacy policy. It is shown within the survey, so all respondents have access to it. But those two, the respondents have the ability to opt into the community survey panel and the market research panel.
So even down the line, since we got the agreement with them, if there's, something that can always be brought up to the board, there's probably something free you want to do on another matter,
Okay.
board related, we can talk that through.
I didn't know if.
Yeah.
Since you contracted with them, if Douglas County, for instance, could own the data, de-identified data, and therefore.
Yeah, you get real researchy like that. I don't know the detail, but I get the
Okay.
answer. But yeah, I
Since
know
if
it's
it's
not.
for free, I'm assuming no.
Yeah, I know it's not
No.
hard IRB type stuff.
Got it. Okay.
Anybody else? All right. Okay, Rebecca, I think we're good.
Thank you so much for having us. And
look
please,
forward to-
please feel free to reach out if you have any additional questions.
All right, see you.
Thank you.
Thank you.
Okay, so with that, I'm gonna go real quick to the reports. And I don't know if anybody has questions, but if they don't, Carol, I got a question for you, so we can close it out on what you mentioned in the report.
Okay.
I'm just curious. So you mentioned, we'll talk about the sequencing piece, because it said as of October 14, 2,000 specimens have been successfully sequenced, and basically 2,087% have been identified as variants of concern and of interest. And that got variants of concern include United Kingdom, South African, Brazilian. I was just curious when I read that. Are you seeing something, Or is it, I haven't heard anything, you know, before Delta blew up to be the dominant one, there was rumors, are you, based on that sequencing data in there, are you all in UNMC seeing something come in or no, or?
I'll answer quickly and then I'll have Justin put in his
Okay.
2 cents worth. Basically, these are the variants that we've seen
All
since we started the
Okay.
sequencing.
Okay,
And since June, Delta has been pretty much the only variant
okay.
we're seeing. And if there's anything else, I thought I saw Justin.
No, I don't think there's
Okay.
anything else there.
So
That's
just in the future, if something was to happen, it would be that similar scenario that's happened, like it would roll from the East Coast in. Ideally,
So you
even like with COVID, it kind of felt like it rolled from the East Coast and the West end.
right.
The different variants kind of rolled East Coast in, so there would be some, at least for us being in the middle, there would be some warning light that's saying it's coming.
Typically, we've got some sort of warning. CDC's identified it as a variant of concern, and then we start to watch for it. In particular, you know, in the past, we've identified people with travel history and things, and we try to get them sequenced.
Sure.
To, again, very quickly identify it and then shut it down, so to speak, with case investigation and contact tracing.
Sure. You have a report question? All right, let's go back up to action items and letter M, and then I'll turn it over to Dr. Hughes.
So for action item M, we have a resolution to honor one of our employees who is leaving us at the end of the week. This is a resolution for Ms. Carrie Kernan. Whereas Ms. Carrie Kernan came into employment with Douglas County Health Department effective January 19th, 2016, and has resigned effective October 22nd, 2021 at 5 p.m. And whereas Ms. Kernan served in the role of Chief of Community Health and Nutrition Services, overseeing clinical operations, WIC, and the health promotion team. And whereas Ms. Kernan acted as a strong leader, attending not only to the success of the programs she oversaw, but to the growth and well-being of the staff she led. And whereas Ms. Kernan brought into Douglas County Health Department over the course of her tenure, several millions of dollars in grant funds to support numerous public health initiatives. And whereas Ms. Kernan was instrumental in overseeing and carrying out COVID-19 response activities, to include strategizing, planning, standing up, and executing mass vaccination clinics and other community vaccination sites, ensuring testing capacity reached all residents of Douglas County. And whereas Ms. Kernan showed outstanding commitment, not only to the residents of Douglas County, but to dismantling the barriers and structures within the local systems which led to racism and health disparities, leading her to develop strong partnerships throughout the community and demonstrating equity in all policies. Ms. Kernan was a leading supporter of Douglas County Health Department's health equity work, the primary author of the Board of Health resolution declaring racism a public health crisis, and secured multiple grants to further this work. Now therefore be it resolved by this Board of Health, Douglas County, Nebraska, that the Chief of Community Health and Nutrition Services, Carrie Kernan, be officially recognized and honored for her work and tenure with the Douglas County Health Department, which will end effective October 22nd, 2021 at 5 p.m. Ms. Kernan, the success of Douglas County Health Department and the health of Douglas County's residents would not be where it is without your tireless commitment and ongoing efforts spanning the past nearly 5 years. We thank you and we wish you only the best in your new endeavor.
So if I may, I'll turn it over to the board, but I was gonna say a couple of things to recommend. You know, Carrie, I hate to see you go. And I understand, you know, opportunities, reasons, but at least having the honor to sit in on even your interview. With Dr. Cocaine, I kind of felt like I've been here with you from the start and had opportunity, particularly former Councilman Gray and myself when we spent the week at Morehouse. And that was interestingly, in regards to like all of us kind of got up to speed and planted that seed for the whole equity piece. It was the division chiefs have been spectacular around here. You fill some big shoes and left your mark. In addition to that, the only thing that a lot of people could ever say is that you leave that position better than it was when you found it, even in the short period. And swallowing COVID and a whole lot of things. There's not a lot more I can say for your work, and thank you. Personally, I'll miss you. Just because you've done a lot of, you've done a lot of things, but you know, I understand opportunity goes where it is, but I'm sure everybody have their own words, but on behalf of everybody that served, thank you for your time. It's not like you'll be away. I'm sure we'll see you to some degree, but I miss you.
Thank you. Thank you. Same here.
I echo, excuse me, what Chris said, because I think we were both in the interview when you were hired. And I can't say enough about how impressed I was in terms of you just, I mean, literally hit the ground running and seem to just continually pick up speed and do more and more and more and more. And I'm just like, wow, it was impressive. Your networking within the community was so extensive and so inclusive that I just wish you all the best, Carrie. And you've been a real exemplar for somebody who's, you know, going to take over that role. As Chris said, they're gonna really big shoes to fill. So thank you very much.
Thank you. Appreciate that. Great.
Mr. Chair.
Yep, go ahead. Yeah.
Yeah, I just wanted to say a couple of things real quick. I just wanted to say, Carrie, first of all, this health department this health department was privileged to have you. Your tireless work ethic, your commitment to the community, the unwavering commitment to the community is it was a joy to watch, and I hate to see you go. Those are going to be tremendous shoes that we'll have to fill, Dr. Hughes, but I think, Carrie, I wish you well, but it was really a pleasure to, as Commissioner Rogers said, to spend the time that we did with Morehouse on a significant issue that we were working on, along with the commitment that you have made to this community, the work ethic that you have provided to this community is unwavering. You will certainly be missed. But I just wanted to tell you, I am very thankful for having the opportunity to work with you on some of these issues that are so important to this community. Thank you, Mr. Chair.
Thank you.
Thank you.
You want to say anything?
Yeah, I think it has been an honor and a privilege to work both with this team at the management level, definitely with our team within all the sections of the programs that I oversaw. I think just the health department and the community are at the cusp of really amazing, integral, and really important work, especially with this equity. And I felt very honored and privileged to be able to start this journey. I'll be sad to go because of that, in addition to everything else that we've been working on to really improve the health of the community. And I think the amazing partners from the board, from all the community organizations that I've had the privilege to work with, this has really been a true honor over the last 5.5 years. So I thank you all for that honor, and I will miss the work and I'll miss the people. So yeah, thank you very much.
All right, we'll transition into
A motion
oh, sorry.
You got it.
to approve this
Is
resolution.
there, I just move for unanimous approval of item M, and we'll say all in favor, aye.
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 Most definitely.
By unanimous approval, item M is approved. we'll go to item 5 and the health director reports, and we'll start, we'll turn over that views.
All right, well, to start my report this week, I do have a longevity award to give out. In our WIC clinic, Miss Marcia Boyd. You want to come up here? Marcia has been one of our WIC clerks, and she is celebrating 25 years of service with us in our community. So we're very, very excited, and we're so grateful to have you. And she makes a mean cookie, guys. I just have to tell you that. So thank you very much for everything that you do, and we hope that you'll stick around even longer.
Thank you.
Cassandra, do you have anything that you want to say?
Just, I guess that, you know, I've had the pleasure of working with Marcia for the last like little over a year since I've been here, and it's been a pleasure. And she's just a wonderful part of the Town WIC team, and appreciate all your time and she's so program.
Thank you.
She's amazing. Thank
You're
you.
welcome.
So that's why you all are 100, you all 120.
No, I'm at Center Street.
Yep.
Got it, okay. All right.
Thank you.
Thank you.
Congratulations.
Congratulations.
All right. Other things we have going on here at the health department. In terms of personnel, Carol Isaac, she is our femur nurse, has also retired, and that will be effective. Remind me of her date. The 29th, end of the month. And then, of course, Carrie is leaving us next Friday. Some other staff changes we've had. Molly Elston was promoted to supervisor of the STD and immunization clinic, and she's doing a fantastic job there. Patty Falcone was promoted to the supervisor of the health promotion section. So we now have a vacancy in health promotions for the community health educator 2 position. So we'll be recruiting that. We've had a couple of new hires. Colton Walensky and Robert Pratt are going to fill our 2 environmental health specialist 1 positions. We do have some interviews coming up for our emergency response coordinator positions. If you remember, we lost Terry and Igor pretty much at the same time. And so we do have interviews underway for those 2 positions. So hopefully we'll have some good people in place there soon. I'm also very excited to let you know that we are interviewing for the health equity advisor position later today and tomorrow. So I think we got some good applicants there. Some other open positions, community health educators. We have an epidemiology position open. We have 3 public health nurses for 1 for TB, the femur position, and an STD position. Some community health worker positions, there are 6 of those, and a clinic clerk, and then of course the emergency response coordinator positions for which we're interviewing. We also held a CPR and first aid course last month, and 16 of our staff passed and are now CPR certified. So we're very happy to have them up to date on that. I also wanted to update all of you on our accreditation efforts. So as you know, we've been working for some time to get the FAB accreditation for our health department. That had been pushed to the side a bit because of COVID. We had kind of ramped back up, then the Delta wave happened, pushed that kind of to the side just a little bit again. But I wanted to let you know that we are very much pushing forward with that. Currently, we have 6 months to basically get all of our documentation in order and turned in. So part of that is making sure that our strategic plan is moving forward. So all of you should have a copy of the strategic plan, and I just wanted to give you a quick update on our progress there. The first thing that I want to tell you about the strategic plan is that all of our dates are now invalid because most of those dates were set before COVID happened. So we will be reconvening our strategic planning group just so that we can update basically are the dates that we want to achieve our goals by. So the content of the strategic plan is still pretty solid. I don't think that we need to make a lot of changes there. It's really just a matter of updating when we want to have achieved the benchmarks that we have in here. That said, we have actually moved forward on a few things, so I just wanted to give you a quick update there. So 1.1, which is really focusing on communications. Mr. Phil Rooney and I have worked together quite a bit over the past 3 months on communications within and outside the department. Phil is going to restart our committee there just to update our communications plan to make sure that that is still what we want it to look like and where it needs to be. So pretty much anything under communication for this plan is really being looked at by Phil and will be looked at by that group as well. I did also want to tell you that in September, both Mr. Rooney and I went through media training with the Lucas Partners, which if you've never done it, fantastic opportunity, fantastic thing to do. They put you through mock interviews, they tape you, and then they play it back and they make you watch yourself. Very uncomfortable, but actually one of the best exercises for identifying areas that you need to work on. They give you great instruction for how to deal with talking to the media and things like that. So not that Mr. Rooney needed it at all because he's an expert, but I definitely felt that that was something that was helpful for myself. And we have a couple of other staff who we know go through these types of media interviews frequently. We're going to also put them through that as well. We are also talking to several agencies and others looking at proposals for part-time social media management. So that's not really something that we have capacity to manage in-house necessarily. We really want somebody who has expertise in that specifically and knows all the rules about what content should look like, how often you should post, things like that. So we are working on all of those sorts of things at this time. If you skip forward to page 4 and look at objective 4.1, this is looking at staff development and really looking more at communications and team building within all of our staff. So that was something that was very important, of course, before COVID-19 hit. We are starting to have conversations about that again. So we will be planning for these types of in-services coming up soon. We don't have dates, obviously, on that just yet. I also am planning to start holding monthly staff meetings, all staff meetings. One of the challenges that we have, as you can imagine, sitting in this room with just the few of us we have here, we don't have space for all of our staff to gather and meet together frequently. So for the time being, that will be on Zoom, which, you know, the position that I came from previously, we did that weekly. It was very convenient. It's not, you know, I would much prefer for it to be face-to-face, but in the absence of the space to do that, we're gonna just do it on Zoom. But I want to ensure that all of our staff are able to feel like they're engaged and able to feel like they're all part of our team here at Douglas County Health Department. We previously had also started some culture work here. If you're looking at objective 5.1 on page 5, it's in the middle there. So I've started also looking at that, trying to get in touch with the person at UNMC who guided that work. I haven't gotten a response from her yet, so I'm going to keep asking for that. I would really prefer not to reinvent the wheel since that work has already started. Again, if you look at the bottom of page 5, I'm talking about a system to hold management accountable on changes in decision making. So we're having that monthly all staff meeting. I'm also increasing the tempo of meetings with our management staff, our chiefs, and then I also will be having weekly one-on-one meetings with our chiefs to increase our communication and just make sure that all of us are pushing forward on the same goals and that our communication is really tight here. So our accountability should increase quite a bit. We should all be communicating a lot, and everybody should be on the same page. All right, 5.1.6 is talking about, and I'm sorry, I forgot to change the color on that one, but working on bridging all of our staff, because all of our staff are kind of in different places, and there's kind of a feeling of being siloed to an extent. And I've started conversations for how we might in the future be able to co-locate more of our staff and really bring people together more in a team working environment. Right now, it's just difficult because we've got upstairs, we've got downstairs, we've got 2 separate WIC clinics, we've got air quality out in a different spot. People are just kind of disjointed. So really, and of course, vital statistics is out in the Civic Center. So really finding a way that we could better co-locate our working environment. Obviously, that's a long-term kind of solution. In the meantime, I am trying to make an effort to make sure that I personally am getting out to each of those areas on a regular basis, just to talk with staff and make sure that they know that I am available to talk to them whenever they need it. Moving to page 7, 6.1.1, and I'm sorry, I know that this is there's a lot of different measures on here. Position descriptions and job audits are being conducted as we have staff turnover. So we are working on revising our job descriptions and making sure that they're up to date. We are also working on updating our policies and procedures. I believe you guys voted on chapters 1 and 2 today. So you'll continue to see those pretty regularly. We have a plan for moving through those over the next couple of years. I also started working on a position description for a deputy director. So that will be coming forward to you very soon as well. And then with that position will come some minor restructuring of the chiefs, the C-suite, so to speak, and just responsibilities more than anything. All right, moving on to page 9. If you look at objective 8.1, pursuing new ideas. While I don't have any new ideas right now on the table, to give you an example, one thing that I've really tried to do since I came is to set the tone that new ideas are welcome, and to really make sure that everyone feels like they can have a voice here. And then 9.1.3 at the bottom of 9, which is remote work and adjustable schedules. We actually put that before the labor unions in the current contract. So those are currently under negotiation. So more on that to come. And then if you flip over to page 10, 1.1.1, hire social media marketing expert manager. Again, that's an area that we're working on, collecting proposals for someone who can help us with that. Then I believe the last one is on page 11, streaming Board of Health meetings. We are doing that currently. So that is something that we've definitely been able to do. And then on formal concrete communication plan again, Mr. Rooney is working with us on that and reassembling that committee to make sure that our communication plan is where it needs to be. Does anybody have any questions? I know that was kind of a fire hose.
So yeah, let me back before we give everybody a chance. So
Yeah.
on the one you just noticed, I guess my question is, when you all CARES Act, did you all use money to upgrade just the technology in here? Since this is going to be the first of a lot of stuff.
You mean as far as the TVs and the systems here?
Yeah, because I think the point is that, like now, I guess I would tell you all, if we want to move this to a bigger room, we're gonna have to get on the books with the building commission now and just book it that Wednesday off, so you don't get bumped by them. But even if you don't, I'm thinking of, do you need to include a little bit of money in for this money now to just upgrade this room and make it work. I mean, ideally, my thought would be, other than by law, us that has to be here, we upgrade the room enough where, you know, believe it or not, people don't have to come and they can get there, because there may be some opportunities where we're gonna be stuck, so to me, the room should be upgraded. Like you, kind of like we did 903. We just made it, so you ain't gotta, I mean, I know you're trying to split it up, but that'd just be my consideration on the, on that aspect of it.
I have a lot of thoughts about this building and upgrading, some upgrades that need to happen.
Oh, yeah, that's another matter. Because I was gonna go back. I gotta, just a note here to ask us. And Carol's probably the only one that would know. So before we moved here, your only experience was on the 4th floor in the old building.
No, we were also on the 10th floor.
Oh, really?
Yeah, because we started out on the, I mean, my.
I didn't know you all on the 10th floor. Was that?
Yeah.
Okay.
We, when I first came, we were all on the 4th floor. And then we outgrew that space, so they knew we had to be out in the area, which at that point in time, they had data, FE, the, you know, the immunization registry, they moved us up to the 10th floor. So until, you know, until we moved here, FE was up on the 10th floor.
Okay. When you all were on the 4th floor, was everybody there except Vic at one time?
You know, most everyone was there. The clinic was a little bit different. I mean, we didn't have a clinic on the 4th floor, so the clinic wasn't there. The WIC offices work outside like they should. We also have people over in the building right now that is housed by HHS. And we have people in the lab. I mean, the STD control is in the lab. Or in that, or in the health center, along with the lab. So we've always been a little bit
Spread out.
spread out. That's a good word for it. And, you know, from my perspective, I think there was nothing better for this department than if we could all get more centrally located.
Well, I say that because if that's the case, then you need to give some real thought to that and make sure it's thought through, because you know, if you're trying to put an upgrade in the building to make it up to speed, I don't know if that would go just because you got so many other people here. I think if you're gonna think that out, think about what you want to bring into Jerry, and then that pitch would have to go to the board about what that place is, so they can be on the lookout for if we need to look for something, because space at the main spot is a premium. I can say that, like, for instance, whenever that new building gets built, you move the county attorney and everybody out, but they already talking about courtrooms and other stuff to that degree.
Sure.
The main building just will never get quite there. So if there's somewhere, I think you need to get in line with the staff and then put about what they want, and then put it on Jerry's radar to look and plan in the future for it.
It's on Jerry's radar.
Oh, it is already, okay. Okay. Because okay.
Yeah, it's definitely, it's something that I think would really improve morale and really help us to de-silo and help us. If you look through the strategic plan, there's a lot that talks about cross-pollination of programs and really doing more cross-training and working together, and that can be very difficult when you're kind of all disjointed. And so having us together not only helps from that perspective, but also from a communication perspective. You know, I don't like playing telephone with staff. I don't like, you know, having to give this person information and they have to then give it to this person to give it to that person. It's so much more effective if everybody can hear the same message all together. And so just changing some things to bring us all together in different ways, I think it's going to be really helpful for the time.
Okay.
So yeah, it's on Jerry's, it's on his radar.
Okay.
He knows what I want.
All right, I'll talk to him.
All right. I know that we've kind of
Yeah.
gone, any other questions?
All right.
Cool. Anybody want to hear about COVID? Anybody sick of hearing about COVID? Yeah. Cool. Is the dashboard up or do we need to bring it up?
Yeah.
Okay, cool. I'm gonna try to actually see what's happening here. It doesn't like me.
Yeah, this is on.
You wanna type in-
Are you looking for the health department?
Yeah.
It's this.
Because I can't see the right here.
Down.
Where?
One.
Right here?
Over. One more.
Right here?
Yep. Yep, that's it. You can't see because of
It's the glare.
the glare.
Okay.
One of the upgrades would be a little mini screen.
Right.
Over there.
Yeah, we're gonna have a, yeah, ooh, even better would be like the,
A monitor.
if we had the,
Right.
in the legislative chamber, that
Yeah.
set up, that would be money. All right, well, here is. I don't want this one. Wait, I want this one. Okay. Here is, oh, can the people on Zoom see this? Are we sharing?
Can you all see the screen on Zoom? Okay, no.
We'll get it. We'll get it for you here, just a second. Is that better? All right.
Got it.
So my good news for today, and actually for the week, is that we continue to see a decline in our overall case counts. So 142.6 per 100,000 for 7-day total. That feels like a lot of pressure off, although we're not anywhere close to being out of the woods yet. That is a far cry from the 255 per 100,000 that we were reporting a couple of months ago. So we continue to see a decline there, and that's great news. So you can, if you like visuals, you can see that on the chart here. You can also see though that we're still in the high transmission category. So to get out of that, we need to drop below 100. And we also need our case positivity rate to drop. So when both of these indicators are below a certain level, then we'll be able to drop into that orange category. And then I believe when the case count is under 50 per 100,000, then we'll manage to get back down into that yellow category, which is really feeling a little bit better if we can get there. So we're on a good trajectory at this point. We're going to keep our eye on that. This is pretty much mirroring what we're seeing as Commissioner Rogers talked about a little earlier when he was asking. We do tend to see the trends a little earlier in other parts of the country, so we can kind of watch what's happening and maybe guess what's going to happen here. So this is kind of following the same patterns that we're seeing elsewhere. So that's good news. So for cases, the largest proportion of cases that we're seeing, and I'm going to zoom in here for you, this is by age, continues to occur in our younger population, which isn't surprising since there are unvaccinated or big unvaccinated population. So we are still seeing a larger percentage there. It has decreased from where we were last month. So this is where we were sitting last month. This green and yellow and orange is what we're talking about here. So this is where we are this past week. So you can see it's decreased, but it is still that 0 to 19 age group is still our largest proportion of cases. So that is something we of course continue to keep our eye on and prioritize. I believe yesterday our school, so our K through 12 district rates were at 2.3 per 1,000 students. And there's not necessarily like a benchmark for what's good or bad there. We're just kind of using it as our own measuring stick, if you will, for the districts to kind of know where they're sitting. So that's about where they've been. It's kind of gone up and down a little bit, but essentially, if you look at kind of this trend, that cases per 1,000 students has kind of done the same trend there. So we continue to work very closely with our school districts to contain, those clusters and outbreaks that are identified there. Did I hear somebody wanting to talk? Okay, it was just a glitch. This is our weekly map that shows our kind of where all of our cases are happening. Let's zoom it out just a little bit for you. So you can see, and this isn't complete yet, because I'm going to back it out another week for you. There you go. Our current week isn't complete yet, so that data isn't accurate as of right now. Or it's not a full week's data yet, I should say. So you can kind of see where the hot spots are here in the community. So really that central and south Omaha area is really where we're predominantly seeing cases. If you want to see what it looked like the week before that, you can see kind of up in the northern area, the Bennington area, was a little hotter last week and then it cooled off. Hospitalizations, we continue to have a high occupancy rate in our hospitals. That's something we absolutely have to keep our eyes on. We finally had a day that was below 80% occupancy yesterday. It was 79, so we're not saying it was significantly below 80. So 80% occupancy rate in the region. We still have hospitals that don't have beds. So when we say 80% in the region, that means that some of our hospitals might have beds, but some may not. So it's just kind of an average out across the whole region. So definitely we still fight for beds. Our ICU rate was at 84% and we had 27 ventilators in use for COVID. Our pediatric ICU beds continue to be in the 80s for occupancy rates. We had 4 pediatric cases that were hospitalized yesterday, or that were in the hospital yesterday, weren't necessarily put in the hospital yesterday for COVID. But a lot of those hospitalizations for peds that we're seeing are related to other viruses that are spreading right now. So continue to see a lot of RSV in the community and other viruses that tend to circulate this time of year. So the bottom line is that our hospitals are still really, really full. And so decreasing the number of COVID patients that are in the hospital will of course free up that capacity for other people who need hospital beds for all of the other reasons that people need them for.
And this is lagging, right? This is a lag.
Yes, yes.
A probably more accurate indicator of what's actually happening in the community, since a lot of people don't get tested.
Yep. Or they don't get tested unless they're really, really sick. Yeah. Unfortunately, deaths. So death data also lags, and we have certainly seen a higher number of deaths reported over the past several weeks. So last week we had 17. The week before that, I think we had 15 and then 13. 83% of the ones last week that were reported were not vaccinated. So I want to make sure anybody listening hears that correctly. 83% of the deaths, COVID deaths that were reported last week were not vaccinated. And that continues to be about what we see. So between 75 and 80 something percent. So it's unfortunate that we continue to see those deaths that are rolling in. Breakthroughs. are sitting at 1.3%. This is the percentage of people who have been vaccinated and go on to develop COVID. And this is the ones that have tested, obviously. So 1.3%, pretty low. And then deaths in that same group are 0.01, so very low death percentage there. So we can pretty safely say at this point that if you get your COVID vaccine, your chance of dying from COVID is pretty low. Of course, we have lots of information now coming out on boosters. So those who are immunocompromised or in those older age groups and qualify for a booster, we certainly recommend getting that. Talking about vaccines, I bet y'all breathe a sigh of relief when you get to vaccines because you know I'm almost done. All right, I have to move you guys. All right, so we are sitting at 74% of our eligible population having one dose, 61.3% of our total population. I thought I did this and I did not do it as well as I thought I did. Sorry about that. Of all of our residents having one dose. I do want to point out that our Black population continues to lag at just over 40% with one dose. I'll talk a little bit more about that in a second. Almost 70% of our eligible population is fully vaccinated, so almost there at 70%. That would be a great milestone. It's not enough for herd immunity yet, but it's getting there. 57.5% of all of our residents currently are vaccinated. However, again, we are lagging with our Black population at 36, I think it's 36.7%. And our Native population also is lagging at 47%. So, and our Hispanic population is also in the 40s. So we definitely have some more work to do with getting our minoritized populations vaccinated. And again, I'll talk about that a little more here in just a second. Our adolescents are reflecting somewhat closely to what our total population is looking like. 64% have one dose, 57.7 have two. So we're fully vaccinated, I guess we should say. So we're continuing to slowly get those numbers up as well. So a little bit about vaccinations. So I'm sure everybody heard all the news. Last week, FDA recommended boosters for Moderna and J&J. We're hoping for official recommendations this week from CDC and ACIP. They're also having conversations about mixing boosters. Can't give you a lot of information about that yet, other than the FDA will not recommend a specific booster to mix with a primary series. They'll just basically, if they believe it's safe, they'll say it's safe to mix. Those conversations will probably be, I would guess, between people in their primary care providers, or CDC may come out with their own recommendations about who gets what. We'll see. So I'll give more information as we get a little closer with that. We're expecting next week the FDA to rule on the 5 to 11-year-old vaccine. So hopefully we're going to have more information on that very soon. We're all going to breathe a sigh of relief when that happens. Of course, then it also has to go through CDC and ACIP. But the bottom line is hopefully we'll be able to start vaccinating our school age kids sometime after Halloween, but before Thanksgiving, fingers crossed. So that's where we are nationally with vaccines. Locally, we continue to do many different types of vaccination clinics. Just here about a week or two ago, we stood up a drive-through vaccination clinic over at CHI Health Center. It's in Lot D. People are able to just drive through to get their vaccines there. That's a in-place clinic, so it doesn't move around, it's just there. So that's one thing. We continue to do some pop-up clinics. We also have our walk-in clinic here at Douglas County Health Department. That people can come through to get their vaccine and boosters here as well. And then we are still making plans for other types of efforts. And we also have the homebound or home visit type vaccination services that are available. We continue to plan for neighborhood vaccination, pop-up type clinics or ice cream truck type clinics, if you want to call it that. And then we continue to work with our local partners in various parts of the county to plan for things that hopefully will help to get vaccination rates up. I know that there's a Dia de los Muertos celebration on Saturday. I said it right.
You
I'm
did.
so proud of
This is
myself.
flyer. Very colorful,
Yes, and it's
oriented.
this is super exciting. So this is in it's 24th and N, right?
Correct.
Oh,
Right center of, absolutely.
I'm doing great
I
today.
wish I was Spanish.
And that will be from 11 to 2 or 3, kind of depending on, I guess, how busy we'll be. And people can come in to get their vaccine there. That's a collaborative effort. Thank you, Mr. Ben Salazar, for your efforts there. One World Health Center is donating some gift cards for the first, I think, like 50 adults that come in to get their vaccine. And then Douglas County, we will be there giving vaccines. So it's kind of this great collaborative effort. We're going to have some nursing students and some allied health, some other health students there, UNMC, UNO, got all kinds of people who are helping out with this effort. So we're very excited about that. I know that the Baptist Pastors Council in North Omaha is also planning a vaccine Sunday. So you can plan to hear about the importance of protecting yourself and your community as part of loving your neighbor. In church, your church service coming up sometime soon if you attend one of the Baptist churches in North Omaha, and potentially having some vaccination services up in that area as well. So we are working on some efforts. We also have some communication efforts. We've been working with the MOCA docs to hopefully get some PSAs out there. And just really trying to encourage people to get out there and get their vaccination. So that's kind of where we are this month. So with that, questions, and I'm sorry that I talked so long.
Are you giving flu shots and COVID if they want?
So we have flu shots yet?
We're doing flu shots for Douglas County employees. We did two clinics last week. We have one tomorrow, but out in the community, it's COVID only.
Okay.
There you go.
Will you eventually be doing it? Be able to give that both at once?
No, the flu vaccine that we get from the state is for the uninsured only, so we do that just here in house.
Okay.
Is the CHI program that you're talking about, is that also a testing center or is there a capability to make that testing?
I think it's just a vaccine site.
It's just vaccines. We're working with Metro at both their North and South Omaha campuses to bring that NOMI test site that's out at Oakwood right now. And they're working on the contract and that logistics. So I've talked to Kay Friesen and she hopes to get those final locations to me as soon as those logistical things are ironed out.
And then have you met with other like non-Baptist pastors, for instance, in the North Omaha community to see if maybe they could implement the same type of deal?
So I have a message out to some other partners with some other denominations to have similar conversations. We just haven't actually connected yet, but yes, making those efforts.
Question. Back in September, the Board of Health got an email saying that we had been approved for incentives through CDC. Where are we at with that? Because I was concerned that we were not able to get any support to do any incentives. Fortunately, One World supporting us on this. But where are we at with that? Are we not allowed to do that anymore? Or?
So we just had a meeting with our project officer yesterday, and we have to submit a plan that CDC has to approve.
Okay.
CDC admits that this is a new space for them. Traditionally, they do not approve incentives. So I think they recognize that, it's specific to COVID vaccines, and there are a lot of criteria that we have to follow as far as how that money can be used. So we have to submit a plan. We just talked with them yesterday. They're going to send us a template on what's required as far as that plan. Once they approve that, then we can use the COVID health equity dollars. So this isn't CARES dollars or ARPA dollars. This is coming from that grant that we got from CDC to address the health equity COVID disparities. And once that plan gets approved, then we can use those dollars to fund those gift cards or gift certificates or whatever we are approved to purchase.
Thank you. Would you let us know kind of the status of that? I just think that's really important when it comes to doing this community outreach work.
Yeah.
So thank you.
Especially with kids, like if we could support local businesses too, I mean, like even zoo passes, doing things like that to try to incentivize families, I think would be more helpful too sometimes than just a gift card. Or giving options for people.
Yeah.
So I can articulate that. I just want to make sure I'm articulating that right. This whole incentive discussion with us, we can use the funds to get some things for other people to do, but our philosophy is still like kind of pay for shots, so it's not still the same. We're talking about the incentives like gifts, tickets that we probably give to somebody else, like a One World or being in those guys distribute. That's what we're talking about.
Yeah, so so what we have to identify in the plan. So one of the questions I presented on this event on Saturday, are you incentivizing first and second doses? And while boosters are absolutely important, we still want to focus very heavily on those that are not. So I think that'll be part of our plan that, it could be that we say 90% of those incentives are going to be used for first and second doses, and maybe we say 10% toward booster doses with those that are high risk.
Okay.
They have 4 categories that it's very specific. So it can either be food, transportation, general gift cards that are like, I think Dr. King recommended like Visa gift cards, because sometimes it's challenging to get like, say a big box store gift card. And I'm blanking on the 4th category. So I think what we would have to do is, rather than a general food card, we could say in our efforts to support local businesses where we know our community members are using those services, can we get permission to, instead of like a big box store, like a Hy-Vee or a Baker's, could we do something like a Supermercado that's down in South Omaha? That is what they use for their food. So that'll have to be part of our plan. The details will have to be in there so that gets approved.
Question on that. Do you also have a consent for the participants, that they have to sign a consent or an agreement that this is not going to be used for alcohol and tobacco use? Is that part of it, or not for this?
I don't know that we would have any control over that. And that may be something that we can work with the entity that we're purchasing the gift cards from, if there's a way to somehow monitor or limit that. But I think that's a great point that we'll have to bring up and consider for that.
Because I know that that's one of the regulations with One World supporting this. It's a generic Visa card, but there is a consent following that it will not be used for alcohol or tobacco use. So
yeah, that may be something we put in the incentive plan, and then we figure out how to implement that when we actually are distributing.
Thank you.
High sugary beverages, fast food, get out on
Right. Sure.
So who's responsible for doing that action plan?
So Andy and I, Andy's going to be the principal investigator on this grant now. So as we met with our project officer from CDC, he'll be working on that with, and I want to make sure that if the time is right, we can include the health equity advisor and some of those folks. So these dollars specifically, again, are for east of 72nd. That's what the grant was focused on. That's where our heavy disparities are around vaccine and testing, that type of a thing. So the focus is going to start east of 42nd. And then if we have the additional funding and support, we'll go kind of expand that back to 72nd. So Andy's going to be working on getting that submitted once we get the template from CDC.
I should also clarify that with Carrie leaving us, she has become 3 other people, which I knew when she handed me her resignation was my first thought, oh my gosh, I have 3 people resigning right now, because she just does so much. So Andy has taken on some of the work. Leah Casanave has taken on some work. Molly in the clinic has taken on some work. So Carrie has done an amazing job of really ensuring that all of these things have been placed with others on her team. So nothing's gonna fall through the cracks. And I have a lot of spreadsheets set up to really track where things are. So we have a good plan in place, and hopefully we'll be able to get her successor up to speed fairly quickly when we do have somebody. But yeah, she kind of turned into like 3 or 4 other people. So we are good there.
And concerns to that, who would be following the hiring of the community educators?
So the open position that became vacant when Patty was promoted, she will be interviewing with another supervisor more than likely, or a division chief if there's one available. And that'll be hired then within her section. The community health educator 2 has been hired for the Office of Health Equity and Social Justice. So that individual starts November 3rd. That individual right now will probably report to either Lindsay or Leah, however Dr. Hughes decides, until that new supervisor is onboarded. So there's going to be some kind of juggling of staff right now until everybody kind of gets into place.
And community health workers as well, following that same.
So the community health workers are going to be supervised by Patty Falcone under health promotion. She really has the subject matter expertise and a lot of the history about developing that workforce. That being said, remember 3 are going to be embedded in the community, 1 in North Omaha, 1 South Omaha, and 1 kind of midtown to work with the refugee populations. And then the 4 internal will be, call center support, and then the health department navigation team. But those 7 community health workers will be working very closely with the Office of Health Equity staff, so that they're really understanding and getting a strong sense of what's actually happening out in the community, boots on the ground, as we're looking at data and doing messaging and reporting. So it's going to be a very strong collaborative within multiple areas of the department.
Like I said, I'm just concerned on obviously you leading and how wonderful you've been able to establish those communications and those connections with the community. I don't want to lose that when you're gone, and I just want to make sure that those community health workers and community educators feel supported by us and by our community partners that we're working with now.
With the van outreach, it seems like that was pretty successful in South Omaha. I know we briefly touched on this yesterday in the meeting, Terry, but what's kind of our strategic plan, and can One World do more in Omaha as well?
No.
To do the neighborhood van similar?
Yeah.
That's going to be. Tom?
Why is that?
Because there's understanding between One World's south. That's going to be.
I just want it to be done. I don't care who does it, but
Yeah,
I'm just saying it can be done. And like
yeah, but I'm just saying that's going to be an issue.
30-some%, 36%. I'm so worried about this. Like, we need to be worried everything.
Yeah, but I don't know if you can count that. I mean, One World could come in there, and I don't know if that's going to solve that issue to some degree. But I think if that's the case, then we have a conversation with them about that. But One World coming in, doing less than
Even if they're just doing door hangers to say when we're gonna be there, or you can call the county for it and come to the house, or whatever the case may be, but some kind of outreach,
we can talk to them.
just because they're already doing it.
Yeah,
Until that happens.
I think we talked to them to see what the dynamics is, because I know there's we can talk to them and we can see what's going on.
Does Charles Drew have any type of facilities or outreach that they could promote this?
Yeah, but with One World going to walk, and I'd have to talk to. We'd have to talk and see exactly why or why not. But I know there's going to be big issues when we're walking in there.
Right, but just so I'm saying, what currently is Charles Drew, the other federally qualified health center, doing
No,
for
there
the
would
North
be-
Omaha community in terms of
They've
more
got the
access?
vaccine. They're doing some stuff with some pop-ups. So exactly, we'd have to sit down and talk and see what their plan is to do, because I don't know what resource Andrea has doing it and what she's using to, so that's what I'm saying. Just saying that they're doing it, I don't know what resource, both of them resources are totally different, just like there would be issue if Drew was walking around inside. It's just some politics in that, it's not gonna flow. Believe.
So Dr. Johnson, my experience, and I've only been on the board for a year, but it's really doing the work ourselves. And with the support that Carrie has given us through the year, it's pretty much calling the organizations and saying, Douglas County supports us on having an event here this day. Would you be as well supported to the community and letting us use your parking lot? And then we contact UNMC, we contact other organizations to get them empowered to be able to run the clinic that day. But it really has been pretty much ourselves, myself and Mr. Salazar and Carrie working together and then making that bridge and that communication in our own community. We just, yeah, you pretty much have to reach out to them and see. I'm learning a lot about politics, but the work needs to get done and they're very supportive. So I would not hesitate. I would reach out to them and ask them yourself.
Yeah, we used to get a room to sit because I don't know how Andrea and those guys have planned it out, how they've done that, how they're paying, whatever like that. So that's why the conversation have to go about what's possible and what's the food for.
I'm just saying what we're doing right now is not working. And we need to partner with Charles Root or Noah or whoever it is and work on how to make this happen.
That's fair, but you can say that, South Low is lagging too, so it's everybody's trying to gather what they're trying to do to some degree, so I'm not doubting. I don't know what the silver bullet is when you have to talk to it.
And I would love to be able to, I mean, I do, pop up events and stuff and try to organize that stuff, but like, I can't do the groundwork. So like, that's where we need to support from the county health department. Trying to see how we work with it.
No, I hear you, but I don't know how much more groundwork can be done to some degree. That's what I'm saying. Even looking at the vaccine survey, I don't know without being able to do a bigger dig in that and see some of that. That number, at least that number I just saw there from you from there was 40%. The number probably a month or so ago was at 35 dead. I mean, there's creeps, there's increments, but I think everybody's frustrated. I mean, with the general population, it's eating. So there haven't been anything from lack of conversation about how to get them there to do it. I don't know what you do to get across those. And actually, if you talk to if you talk to conversations that I've had with school compared to some other vaccines from the data that I've asked, the question is, they're saying the COVID vaccine is at a higher rate of vaccination than some in regards to flu shots. That's some of the conversation I've heard there. So it's not for lack of it. They analyzed and doing stuff. So I'm saying you probably need to sit down and see what that rationale is and see what can be done. I'm assuming we questioned that. Okay. Any other questions? All right. Any board comments? Okay, so that then is their motion to adjourn. There's a second. Roll call.
Okay, Jones.
Yes.
Emily Rogers.
Yes.
Espinoza.
Yes.
Wilkin.
Yes.
Weiss.
Yes.
We're trying to do something. Might sit there, something 15 minutes. Okay, I think we're done. Everybody, thanks. You want to end that?
Yep.
So, Hope, I'm gonna ask you a question.
Yeah.